will become different persons over the course of the next 4 years, and you will define yourself differently in 4 years from now than you do currently, and that's good. You'll have successes, you'll have challenges, you may even have the odd failure to overcome, but as a result of that journey, you will be a different, better person. And I want you to remember that in the course of time, over the next 4 years, you will change, but the Medical College of Georgia will also change. This old building is kind of the anchor.
Like our students, MCG School of Medicine is a continuous work in progress. We provide learning opportunities and excellent clinical venues across Georgia. We also encourage our students to be lifelong learners who want to not just practice medicine, but to improve it. Our nationally ranked research programs, which focus on diseases affecting most Georgians, heart disease, obesity, diabetes, and cancer, give students the opportunity to experience how scientific discoveries move patient care forward. We look for students who will thrive in this dynamic environment.
Clinical education for our students requires that a busy academic health center be part of the educational plan. A partnership with an academic health center, a major teaching hospital, is critical to the completion of a medical education and to experiencing the range of diseases and disease states that students will have to treat when they become physicians.
Hello. Dr. Lynn, nice to see you. How are you doing today?
Nice to see you. Hello.
Well, at the bedside, I think what we try to do is, instead of kind of a paternalistic model where it goes from the teacher down to the student, we try to involve them in the learning, make it learner-centered, make it fun for them to learn. I tend to try and ask a lot of open-ended questions to try and get at what they're thinking and their thought process is. And to be honest, one of the most important things that I can impart in students is an infectious enthusiasm for learning.
All right. See you in the morning.
Good to meet y'all.
We rely on community hospitals across the state of Georgia to complete medical education, and especially to give students the chance to practice with busy local clinicians. Part of what their student experience includes would be opportunities to practice with physicians in communities where they may eventually end up working.
The Medical College of Georgia has been very innovative and taken a real leadership role in getting students out to preceptors. Coming to the office is really a great way to teach students, because that way they're one-on-one, so we're not just teaching facts, we're teaching in the context of seeing patients.
Academic medical center like MCG gives you, you're going to see a lot more patients, a lot more exotic illnesses, so that's very important. And it's also great to see the other aspect, the do-it-yourself. I'm the only one out here, so I mean, I'm getting a great balance right now. I'm very, very thankful for that.
The state of Georgia is significantly affected by many chronic diseases, and the science regarding the treatment of those diseases is incredibly important to the health of Georgians. What we're trying to focus our Discovery Institutes on is those disease states, but also trying to take the steps necessary to create the new drugs and therapies that will actually affect those diseases within this generation and allow the next generation of Georgians to live longer, healthier lives.
We're always pushing research. You know, the Brain and Behavior Discovery Institute, which, Dean Miller launched, that's exciting. We're trying to get our residents and our students involved in this. This year we have about 4 students who are doing different projects in the Brain Discovery Institute, mostly in the stroke field, as it turns out this year. So you gotta bring that research and that spirit of inquiry into people early. It's best to start in medical school.
Students have the experience of being able to work at the bench with these scientists and also in the clinic with their physician educators. They also see patients enrolled in large clinical trials as part of the care plan. So we think that the opportunity for experiencing bench to bedside scientific learning is there and is important to their education.
Now this is easily understandable mainly because it is actually a 4 electron.
Inside our lecture halls, passionate educators share knowledge with our students. That body of knowledge becomes a strong foundation for their future as physicians. Faculty help students learn the fundamentals of how the human body works and how disease disrupts these essential processes.
Many of the students, when they finish the first year and they go to the clinics, they understand actually how much that we taught in the first year becomes so useful for them to become an effective physicians. And therefore that is what we try to tell them, that the basic science is fundamental for you to become a physician, and therefore pay attention to that. And we are here to teach you what you need to become an effective doctor.
You are beginning a marathon, not a sprint. Cramming in medical school does not work. We share state-of-the-art information. We role model in a way of which we are proud every day, but just as importantly, we help instill in our students the desire and passion to continue learning throughout their careers.
Like Dr. Fincher says, it's a marathon and not a sprint, and so just kind of seeing her, you know, pretty much at every test, kind of giving us the same words of encouragement, kind of pushing us along, and knowing that we have faculty who are behind us, who support us, who want us to come and see them in their office if we have questions, to try to really understand the information. I think that that's wonderful.
The admissions committee does work very hard to try to create a class that we feel will do justice to this institution.
These are, you know, young adults for the most part who have dedicated at least a significant part of their development to pursuing a career in medicine. And so it really becomes an honor to sort of be part of that process. So the committee works extremely hard to try to look at the kinds of characteristics and virtues that produce wonderful physicians that hopefully will stay in the state of Georgia.
How many of you put scalpel blades on? They look pretty simple, don't they? They will cut you and hurt you really bad.
We're also looking to recruit and matriculate a diverse student body from the standpoint of racial and ethnic diversity, gender, obviously diversity, but fundamentally those that we think are clear about what they're looking for and clear about their commitment to medicine.
We will build a better MCG and a better School of Medicine. In fact, we're planning right now to build a new School of Medicine building in partnership with the School of Dentistry, using the support of the state and philanthropy. We are going to build a state-of-the-art medical education building, and it will be an exciting place to be able to work with your colleagues there, be able to learn.
The medical school is doing two things. It's expanding to accommodate a larger class to meet the physician workforce needs of the state and the nation, but we're also growing our practice so that our faculty can expand their services to the community and grow their research programs and the funding for those programs in response to the need to address our primary mission, which is to improve the health of all Georgians.
We've seen a renewed spirit of mutual cooperation in Augusta. I think we're seeing that with MCG's expansion efforts, and I'm excited about the potential, and I feel strongly it's a very, you know, they've set the bar high, the Board of Regents has, but I have no doubt we can achieve their vision for the Medical College of Georgia.
Well, part of our strategy is to expand the Medical College of Georgia's class in multiple campuses across the state. This allows us to train students in parts of the state where they may want to practice in the future.
In order to maximize our resources, I've put focus on partnerships and collaborations versus competition within the system, and you clearly see that with the establishment of a partnership campus in Athens between UGA and MCG.
It was suggested by an outside consultant that the Medical College of Georgia develop 2 clinical campuses in the southern part of Georgia and a 4-year campus up here in Athens to service northeast Georgia. So we are the only other 4-year campus of the state medical school. It will allow Medical College of Georgia to ultimately educate 300 students a year.
We basically believed that the university system needed to, in fact, educate more physicians, and the opportunities for increasing the number of physicians educated at MCG is very difficult given the large number they have right now. And so through those discussions and with the Board of Regents and with the governor, we created the MCG-UGA Medical Partnership.
The first goal of the Partnership Campus, of course, is to educate outstanding medical students. And so as part of Medical College of Georgia, in collaboration with UGA, we ultimately want to educate the best quality physician that one can for the state of Georgia. So Steve, I got a few things I want to talk to you about.
I think that programs like this that are going to be so bound to the community, that are going to be teaching students out in the community a lot, have the capacity to produce a lot of primary care physicians or people who are interested in primary care.
I started working with Dr. Wells at the beginning of August. He has a lot to teach us about not only medicine, but how to run a successful private practice, how to be organized in your day, and make sure you move through your clinic efficiently.
Good morning.
Good morning. How are you doing today?
Hopefully they learn something about internal medicine, but hopefully more they learn how to interact with the patients and continuity of care, that there's more to the patients than just their hypertension, their diabetes, that there's their life.
Well, Clinical Campus is an opportunity for students to go away from the academic health center to work with doctors in practice who are trained and experienced teachers, but the bulk of their day is spent seeing patients.
The Southwest Georgia campus of Medical College of Georgia spans from Valdosta to all the way to Columbus. And when our students come to rotate with these physicians who love to take care of patients and love to teach, they really get a wonderful experience.
And then as you can see here,
The leadership here recognize the importance of affiliating with an academic institution. And we are working hard towards enticing students to come down here and see for themselves that what this area of our state has to offer.
The Medical College of Georgia, as the state medical education institution, has lots of alumni in the area. It's been the sort of the icon, if you will, of medical education in the state. And when we identify ourselves as partnering with MCG, it lends credibility from our side. From MCG's side, what they get is by and large a voluntary medical staff who are eager to teach, willing to teach, and capable of teaching in an environment where the students get up close and personal.
Okay, so this is
from day one, Dr. Tolliver, who's my preceptor for pediatrics, she kind of threw me right into it almost and just had me doing things from day one. And the first couple of days I was a little bit overwhelmed, but once I got used to it, time flies. Yes, I feel like I'm having fun the whole time I'm doing it.
The students have the opportunity to have an attending with them at the time that they're seeing patients, saying, listen to this, what do you hear? Or see this, did you see this before? And to have someone point that out to you and to tell you what's important. In real life, this is what you're going to see. This is what you're going to do. I think it makes a huge difference.
We have evidence that we've published that students who rotate in these community rotations do as well or better than the students who rotate in Augusta at the Academic Health Center. So there's no diminishing of the education that goes on, but it's a different method.
We have all of the counties for the coastline here, so it's a nice place to spend some time when you have off time. But it's mainly the medical community as a whole, because so many MCG alumni are in the area. We have a trauma system here in Savannah. We have a number of physicians that are willing to take students and are eager to take students.
I am John Odom, and I'm a staff surgeon here at Candler, and this is the second student that we've had from MCG.
Well, what I like about Dr. Odom is that he looks straight to me to do stuff. So he's like, Joseph, cauterize this, or Joseph, stitch this up, or Joseph, clamp that. So it's been great. So I've been getting a lot of experience with what I'll really be dealing with once I get out of med school.
I think that we all have a responsibility to teach what we know to the extent that we can. And it's also fun.
Oh, Joseph's A-okay. There's so many faculty that are interested in teaching that have had recent and past experience and yearn to revisit that experience since we've begun our alliance with the Medical College.
Doing the away rotations has been nice because you get to go all over the state of Georgia, see different areas, kind of get a feel for where you want to practice. And you also get to know the physician you're working with a lot better, and they're good at catering to your knowledge.
These young souls are in their 20s, and all doctors will have somehow trying to transmit the philosophy and the educational process to the future fighters in the day-to-day fight that is medicine.
We live at the beach. We have a great opportunity for some socialization, but also some exposures they wouldn't get in other cities. We do have a partnership with the College of Coastal Georgia, where we actually maintain a facility on the port of Brunswick, so some opportunities for some industrial and international medicines exposed here at Southeast Georgia Health System, which they can get nowhere else in the world.
It's an extraordinary time. I feel as if in my 25 years here, we've been through multiple times that I thought were exciting times. There has been none that has presented nearly the opportunity for growth of the school and for helping to meet the healthcare needs of our state.
The state is challenged by a lot of very negative medical statistics, whether it's obesity or morbidity, and we expect MCG to be both the policy leader as well as helping us solve those problems.
It is challenging, but it's also very rewarding, you know, to see the progression of knowledge and independence and how students react and interact with patients. It's really the joy of academics.
There have been several days where we'd walk over to the library and get coffee, and I look over to Daisy and say, man, we are so lucky to be doing this.
There's no question that the college and the School of Medicine are a very important part of many people's lives, and it's interesting to me to see how much of their lives are caught up in their experiences at MCG, whether they were trained here as a student or a resident or have been on the faculty. They carry that with them wherever they go and wherever they may work in the future.